All right, welcome everyone. We're going to give just a minute as everyone gets connected to the webinar. And before we start, I'm going to go over a few housekeeping rules and information. This is a webinar format tonight, so everyone will be on mute and off camera throughout the presentation, except for the panel of presenters. We do have a chat feature as well as a Q&A feature, so please use those throughout the presentation to share your comments and reactions and put any questions that you have in the Q&A area so that at the end of the presentation, we can go through those with our panel. There will be some polls this evening, so please, we encourage you to take part in those. And if you need to connect with our Clarity team after the presentation, please use the info that will be on the screen at the end of the presentation or that we're going to put in the chat. We would love for you to drop into the chat where you're joining us from this evening and the name of your practice. And remember that Q&A feature for any questions you have for the panel, you can put them in as the presentation goes. So let's get our evening started. I want to welcome everyone to our special After Hours Clarity webinar this evening. Our Clarity team is very excited to see all of you joining us this evening. This is a really hot topic right now. So let's jump into some introductions and get things kicked off. I'm Lindsay Shaw. I'm the VP of Practice Development at Clarity Technologies, and I'll be the moderator for our presentation this evening. We have on our panel this evening Sam Pondrom from Byrd Adatto. We have Dr. Johnny Franco from Austin Plastic Surgeon. We have Erica Crawford from Influx Marketing. And we're all going to be sharing some insights with you this evening on the FDA and your weight loss program. We're going to look at some of the current legal status on compounded medications, how to pivot and keep your program running well in your practice, making sure that your marketing strategy is compliant and successful. And we're going to round it out with talking a little bit about how patient education can have a positive impact in your practice. We'll wrap up this evening with about 30 minutes of Q&A time with our panelists. So Sam, I'm going to take my screen share off and I'm going to turn it over to you.
Thank you, Lindsay. Yeah, so obviously here tonight to talk about kind of the state of GLP-1s, and I know it seems like every day there's something in the news about them, but the nice part is things are actually pretty stagnant right now, and it's been a nice kind of breath of fresh air ever since from a few months back when Eli sent out those sort of false cease and desists, and then managed to get the tirzepatide pulled off the shortage list and just created a lot of chaos. It's funny hearing y'all talk about, that, hey, this is such a hot topic. We've literally been saying that. Like, I feel like Johnny and I have been talking about this for, 2 years, 2.5 years now. This has been consistently one of the hottest topics that we've run into just because of the, efficacy and the breadth of what these drugs can do. And so it's always on the tip of everybody's tongues. We get a ton of questions about it. It's almost funny now when I'm looking at my schedule and kind of saying like, oh, what's this about? What's this about? When it's about, this stuff. It's so ingrained in my head at this point that I'm like, oh, okay, that'll be an easy discussion to have. So I think first and foremost, we'll kind of look at it from a high level and then jump into where we are now and where the uncertainty lies. Overall, the thing that has sort of rocketed GLP-1s to where they are and now has created the uncertainty is their inclusion on the shortage list. And for everyone who doesn't know what the shortage list is, the FDA literally maintains a list of drugs that there's just not enough of. It is very literal. You can Google the shortage list. It's quite easy to use. You just punch in a few letters of whatever drug you're looking for, and it should pop right up if it is on there. What's really important about the shortage list is if a drug that is otherwise protected from compounding is on the shortage list, we can then compound it without any ramifications, without any concerns about potential backlash from the federal government, from state level governments. And this is really important because when we're talking about any drug, somebody has taken a lot of time and a lot of money to spend to get this drug approved. And for their time and efforts and money, they get an exclusivity period, a patent period. It's usually 20 years. And for those 20 years, essentially, you can only get that drug from that particular party. So in these cases, for the semaglutide side, we're looking at, Novo Nordisk. And on the tirzepatide side, we're looking at Eli Lilly. And when we are under their sort of patent protection, they can set prices where they want, and there's really not much we can do about it. But when this goes into shortage, and there are, there is the ability to compound, now all of a sudden cost isn't set for us. We sort of, obviously there's input costs that go into it, but there is a bit of wiggle room in how we can approach that. And especially if we're talking about, creating at volume, you can actually get the prices down pretty far. And ultimately, that's what all of this comes down to. That's why there has been such a fervent pushback on removing tirzepatide from the shortage list. And it all comes down to money, bottom line. So all this is to say is, if these two drugs were not on the shortage list, they would not be able to be compounded. They would not be able to be priced where they currently are instead of at the list prices for the manufacturers. And that's why it's, the shortage list comes up in discussion so often, because it grants that ability for, compounding pharmacies and individual practitioners to work together to, go essentially around the key manufacturers. And that's why we care. So when we're looking at this, we say, okay, what's on the shortage list? Right now, we have to look at these separately. For the longest time, we looked at them together. We said they're both on the shortage list. Great, who cares? We can compound. That's no longer the case. So on the semaglutide side, it's still on the shortage list, 100%. Like I said, you can Google it, go type in SEMA, and it'll pop right up, and you can see it right there, plain as day. There's no questions there. As far as I know, there hasn't been any affirmative movement towards resolving that. And so semaglutide, without question, without any sort of explanation, 100% compoundable right now, no problems at all. Tirzepatide, on the other hand, is a little bit different. As I referenced earlier, Eli Lilly has been really aggressive in getting tirzepatide off of the shortage list. And again, this all comes down to money. They want their patent protection, they want their protected period, and they want to maximize that. And so the more time it spends on the shortage list, the more it eats through their protected period, and frankly, the more value it costs them. So they've been working very hard to, one, create confusion, but two, also just get it off the list, which in late September, early October, they successfully did. The tirzepatide shortage was officially marked resolved by the FDA. Again, you can go look at the lists. You can see that it's officially marked resolved. The really interesting thing was This move was anticipated by a few trade groups for compounding pharmacies. And essentially, as soon as it came off the shortage list, tirzepatide came off the shortage list and was marked as resolved, they filed suit. And they said there is actually no substantial basis for you to take this off of the shortage list. This drug is still incredibly hard to get a hold of. You have no plan and no capacity to get this drug to a sufficient number of persons, patients, and frankly, that this is a premature move. And the suit was actually quite well received, which is interesting. The FDA sort of deferred and said, you know what, I think there's merit to the claims that are being made here. What we are going to do is this. And they basically put a pause on the resolution from the shortage list. And so as of right now, I believe it's as of October 7th, the judge in the case where, these compounding pharmacy trade groups filed suit about the removal, the judge said, hey, look, if there is compounding action related to the shortage list, we just don't care about it. It's not that they've approved it. It's not that they have, given any sort of affirmative thumbs up. They've just said it is not a priority. The FDA will not pursue or prosecute right now. Essentially, they've taken an inaction stance. And that's really important because all of this is about shortage. And so until something affirmative happens in the case, injunctions are granted, the judge makes a ruling that is in favor of Eli Lilly, something along those lines, and the ability to compound tirzepatide right now is, full steam ahead. There are no issues with it. The FDA was very clear to say that they still are very vigilant about the quality of the compounding, and if there are any issues with quality or the components that are being used or anything like that, they fully reserve the right to come after whoever. But if it is you are a compounding pharmacy, you are compounding this because of shortage, they are just deferring right now and basically saying it's not a priority to enforce. So on both sides, for very different reasons, for both semaglutide and for tirzepatide, compounding is just fine. We're on the tirzepatide side, just playing a waiting game. The judge that's actually the court that this was filed in, and the judge, I believe, is in the Eastern District of Texas. It's in their federal circuit, and it is, we're just waiting to hear from them. I'm sure Eli's pushing as hard as possible to get further action, but it doesn't seem like there's a big push on the government side to, grant them that further action. And especially as we get closer to the holidays, I think the timeline just continues to trickle out. One last thing to touch on. When drugs are removed from the shortage list, this is something we get a ton of questions on. Here's a really important thing, and this is what we want you to take away from this. This isn't a on-off switch. The FDA is very aware of the importance of these drugs. They are very aware of, patient continuation of treatment issues, patient abandonment issues. And so when there are affirmative steps, when there are any potential changes in the status of either base compound, there will be heads up and there will be grace periods that allow us to run out existing stashes and allow us to compound and communicate with our client, with our patients, and ensure that they understand what's coming from, supplies perspective, from a cost perspective, and make sure that there's plans in place to be able to continue to treat them effectively.
All right. Thank you, Sam. We really appreciate it. I'm sure there's going to be a lot of questions towards the end for you. Dr. Franco, I'm going to turn it over to you to talk a little bit about the programs in the practice. All right, you're muted still.
Boom. And can I just say this is why I love talking to Sam, because anybody who was listening to us before, I'm like, there's so much stuff going on, and Sam's drinking water, chilling, and he's like, it's good right now. Everything's cool. So this is that's why Sam's my yin to my yang craziness. So appreciate you kicking us off, Sam, and letting everybody take a little bit of a breath, because everybody's on edge. So I'll jump into it. And weight loss revolution, where are we now? I think this is a interesting timing, but if anything, I don't feel like it could have been any better for practices, because I think a lot of us, did get very dependent on the compounds, other stuff. I almost feel like when tirzepatide got pulled off the shortage list, it was at least a shot across the bow to be like, hey, what's your plan going forward if this happens? And now we've gotten like a do-over, a reprieve, a mulligan, for anyone that plays golf. And so, so now you've had some running room to like figure out where you're going to be. And a little unclear how far that runway is, but you got some time to start thinking about how you're going to do this. And I know Erica is going to talk about, how you kind of make your whatever you decide to do successful. And I think there's a lot of different options to go about this. And even if you're listening to this, I don't know that your option has to just be the weight loss medications. I think there's such a ripple effect here. And if you look at all the indications and stuff coming about, if you saw just today, Zepbound beat, Wegovy in a head-to-head that they just released the stats, that paper's coming out probably in the next couple months. So that's super exciting. So they had FDA had a meeting about peptides today. So that'll probably be released tomorrow. So that's super interesting as well, but all sorts of stuff. This is my disclosures. So I'm going to talk about weight loss revolution. Where are we now? What is the value? If you haven't gotten in, should you get in it? If you are in it, should you plan to go? Where does it fall into aesthetics? I want to talk about, I feel like a lot of people say they have a weight loss program, but they have a weight loss prescription or a weight loss medication and not necessarily a program, and where that kind of all fits. And really everybody who's on here thinking about it. And I used plastic surgery because it rhymed with, pivotal point plastic surgery in terms of life, but really anywhere you are in the aesthetic field, I think we have such a unique opportunity. There's not going to be, I don't know if there'll be a time point in my career where we have such an integral chance to like shape the future of aesthetics, because, since penicillin, I don't know that there's another medication that affects so many people in such a broad category. And there can't be, at least once a week, you see something on the news for any of us that still watch the news, which I do, and my staff makes fun of me about, but it's interesting about the new indications that come out for this. So you're going to see the sequela of the weight loss, the skin laxity, the volume loss for years and years to come. And the reason this has been such a hot topic, as Sam talked about, is there's nothing else in our aesthetic field that has affected so many people. I mean, none of us go throughout our day that doesn't either affected us personally or somebody that we know that hasn't either benefited, tried these medications, related to this. And so, breast dog, Botox, those things are popular, but not to this mass effect. And so I think that's why it's been such a hot topic for such an extended amount of time. And it still blows my mind. I'll be out and be talking and I'll run into someone and be like, oh, I didn't recognize you. For anyone who doesn't know, I've lost about 90 pounds. I'll be telling them about the GLPs and they're like, what is that? And it blows my mind that some people are still like, have no idea, which is it shows how much opportunity there's still out there. And so, I hear sometimes too that people talk about that this is going to go away. It's just a fad. It's just in passing. I think everyone that's on this doesn't believe that, but the amount of sales, the amount of advertising, almost $1 billion. And that number is only going to go up as more companies come into the marketplace. So, I mean, the amount out there, I was literally sitting here as we were talking, and I saw an Ozempic ad come on the TV. So, I mean, that money and reach out there is not going away anytime soon. Sam talked a little bit about it. I know that Erica's going to get into this. It's definitely been a little bit interesting of a roller coaster ride. When it first came out, it was so hard to get a hold of these medications, and that's why it got on the shortage. That's where the compound stuff kind of exploded. And just having the medications was enough to make your program and your practice explode. But that has changed. And if anybody has kept up with this, the Hims and Hers are offering as low as $99 a month. Eli Lilly itself, has its own program where they've slashed prices. Sam talked a little bit about these kind of false demand letters that Eli Lilly sent out. So definitely been a kind of work in progress, but I think it's really been a mindset change, because a lot of people just had these medications. They just had a medication and called it a weight loss program. But I tell people, think about it like if you're starting a med spa, right? If you were going to start offering Botox or RF microneedling, I mean, you're probably not the only person in town, unless you're in like Fort Hancock, West Texas, or something like that. Anyone that's from Texas, this tiny little town. If you're in Austin or Houston or Dallas, where Sam's at, I mean, there's probably, 100 practices offering Botox just in your square block. And so, what really makes you stand out? What's different? What's the unique value proposition you're going to do? And how are you going to speak to those? And I know Lindsay's going to kind of give you some ideas and tips about how to really do that in an efficient manner. I think there's going to be this revolving door of medications. You've already seen some of it come. There's somewhere between 80 and 120. I've seen different stats of medications in clinical trials based around weight loss and GLP. So, I mean, if you think about 80 and 120, and some of it is with some of the AI targeting, they can make little tweaks and actually examine some of these meds, which is super cool. So many different things in terms of new hormones, orals, different formulations coming. So many exciting things. And this is, I know, super wordy. And also too, just for any of you trying to do some marketing stuff, because Erica and I love this. I actually made this picture on ChatGPT. So pretty cool how you can do some really easy stuff. But here's just some of the future medications. Probably the one I'm most excited about is the first one, another one from Eli Lilly, but it's nicknamed the Triple G, because it'll actually affect 3 peptides. And so actually has been found in the studies to be more effective than bariatric surgery. And so, with kind of standard ratio stuff, so the amount of weight change you're going to see, and that'll probably hit the market next year. Sam alluded to this, so I won't beat up too much time, but here were some of the dates from this. And so, it was scheduled that they were going to make a statement right before Thanksgiving on 11/21. Didn't end up releasing this joint statement. Got pushed back to 12/19. Sam can jump in afterwards and his thoughts on that, but thoughts is that will probably even get pushed back again during the holidays and with some administration changes and other stuff. I don't know that anybody's in a super hurry to make any kind of quick statement. So still a lot TBD there. When we're talking about what to do in this complicated spots, I always tell people, take a step back, because I think there's a whole spectrum of here. And I don't think everybody in the aesthetic industry has to be a weight loss clinic. And if you are, I think you really need to think about it and develop your business plan. Just like if you were going to bring on a new surgeon, if you were going to bring on, a new injector, if you want to add lasers to your practice, because there's so many different time points you can be. You could be a weight loss clinic. You could be an overall wellness regenerative area and have this be part of that. Some of the surgery practices just treat their own patients because they just don't want to lose the patients they have. And so that way they're just retaining them, which is fine. You also could develop an area where you're specializing in treating some of these unique weight loss patients. And so I think there's a lot of different places and time points to be part of this conversation, but I think you need to decide where you want to be a part of that conversation. Been playing with this kind of idea called the Ozempification of aesthetics, and anyone that's heard me talk, has seen this evolve a little bit over time. But I do think you see this really, really unique patient population, especially in our world, because most of the people coming to our offices, are your younger patients, healthy patients. They're not your people in the, endocrinology, obesity clinic that have multiple comorbidities. These are the fun patients, right? Because they're young, they're super responsive to energy devices. These are the people that look absolutely fabulous on your surgery because they got good skin, they're healthy, they're going to recover, they bounce back really, really well. anyone who's been in the industry for a while knows that men is always a hot topic, and really the stats haven't changed very much, as Lindsay can probably attest to. But weight loss is something that speaks to everybody. And I really think that you're going to see, this whole new wave of patients coming in. There's this whole aesthetic naive patients, and the aesthetic naive patients are these people that are coming in because of weight loss and that never would have come into your offices before. But because they're aesthetic naive, it's a different conversation. It's going to take longer to go through there. And that's where I think, whether it's clarity, whether it's something else, I think you need a way to message them over time. And I know Erica's going to touch base about some of those things, but you really have to find a way to speak to them and speak to them repeatedly, because they're not going to jump into this like somebody who actively sought you out for a breast aug, Botox, those type of things. And I also think that there's some really unique opportunities with AI to level the playing field, whether you're a small practice, whether you're a mid-sized practice trying to compete with some of the private equity. So I think there's a lot of opportunities out there. This is part of the Ozempification. If you're going to take something home, check your website, check your social media, how you talk about this. I'll tell you the two most visited pages on our website is Ozempic Face and Ozempic Butt. When we launched Ozempic Face, we had a 250,000 views in the first 3 days. Ozempic Butt had 75,000 views in the first day that we launched the page. And so, it just tells you how many people are searching for this, how many people are looking for it. Also gives people an opportunity to own a space, right? Probably unlikely that in your city that there's somebody that's the Ozempic Butt expert in town. Probably have somebody that does a lot of facelifts, rhinoplasty, something else, but you can create something that's very unique and special to you that I do think needs some special attention because of the unique patient population. I do think there's a lot of aesthetic naive patients coming to offices into the aesthetic field. So I think there's going to be a really unique way to talk to them. I think it's going to take a longer time period. And this is where I think you can leverage some of the AI and some of the tools out there to really be able to speak to them over a period of time, so that when they're ready, as they're seeing these changes, you can educate them on what's best for them. So when we're talking about pivotal points or how you pivot your practice, I think it's taking a step back and looking like what are the opportunities out there? What are the needs that patients have? So you have this wellness wave coming, right? Because people are losing weight, but they overall want to feel better. They want to do things. It's been amazing. I've lived it personally, so I've felt a lot of this, but hormones, peptides, a lot of these things have jumped up. You're also seeing a lot of really young patients. So a few different needs in terms of this. So, interesting how reactive those young patients have been to this, and how we've had to change some of our treatment plans to make this into a better spot that fits them very well. I do think, there's a lot of positive, but there's also some really unique challenges, and where there's challenges, there's opportunities. And so, you're seeing these skin laxities, you're seeing these volume loss, you're seeing, these young patients we were talking before. If you're 27 and they've lost 60 pounds, do you offer them a facelift? Do you do, 18 treatments of RF microneedling and biostimulants and some of the new fillers coming on the market? I think there's a lot of really unique opportunities where we can pave the way for things. But I do think there's a second cosmetic wave coming. We've started to see it in our practice. We do more body lifts than I've ever done in my career. It used to be we did 1 or 2 body lifts a quarter. Now I do 1 a week. And so pretty interesting how those patients have come through. And now that they're part of the journey, I do think there's been about a 6 to 9 month lag for that. Some of that is on purpose because we want to get them to a good spot before we move over. We've also in our practice, really tried to pivot from just a weight loss medication to an entire wellness program. And so part of that is doing body compositions, looking at metabolic health. There's a way to do phenome testing because you can do some precision prescribing. While the GLPs get all the hype, there's so many other medications out there and some other really cool things that you can do that are a much lower price point that can help patients along that journey. You can also help them because if you're prescribing it and it's expensive, some of these tests actually will tell you how effective those GLP medications are going to be for them. So then with confidence, they can be like, oh, wow, this is going to be effective. Hey, maybe this won't be as much. There's ways to do personalized labs so that even if you're not a clinic that has labs that are easy drawn or it's harder to get people, like for me, when I go in, I just want to get everything. I don't want to get, okay, send me a prescription to go to CPL to go somewhere else. So being able to just send them home with that, I think there's some really unique opportunities. I think this is what's key, because not everybody's going to see, 2,000 weight loss patients, in their office stuff, but you're going to see these changes if you're in the aesthetic industry and really talking to them. So we created these treatment plans that we talked to them about. Here's the things you're going to see. Most of the aesthetic naive patients, like, that's not me. I'm not into that foo-foo stuff. That's not what I want to do, but then they get their drip campaigns through your CRM or through Clarity, whatever you're doing, so it's telling them just like, hey, here's what you're seeing. Here's how you can treat those. And then all of a sudden, by their third, fourth visit, they're like, I do see a little bands, like maybe I do need a little this. And it's funny because when they start getting compliments, they just want to do more. It becomes addictive. Before my journey, I'd never done anything except Botox. Now I've done jawline filler. I've done some biostimulants. I'm thinking about getting a little neck tightening like that. So, I've done all the stuff to give away my beauty secrets here. But I do think there's still some value in the weight loss, but I think just having a medication is not enough. I think if you're starting a program and you think just offering this medication is going to be enough, I think you're really, really struggle, because then we're going to get tight if you're just trying to compete with the hims, hers, and some of those things. I think then you're always dependent on what happens with some of these medications. And really, it's going to be tough to develop that following if you don't have a unique value proposition that's built in around. I think if you're really into the wellness, I think there's a huge opportunity. I think this is a great thing to incorporate. I think skin laxity is going to be one of the biggest issues for the next 10 years. I think we have all sorts of opportunities to treat some of these things. Some of the current and future trends, just to leave you with a few last things, is you're going to see skin laxity. You're going to see volume loss. You're going to see the wellness continue to explode. Wellness has been a thing, but most of us that are plastic surgeons and so forth have always kind of been like, well, wellness is just kind of this hot term. But I really think even the GLPs is one part of it, but there's so many other regenerative things that I think have really taken the next level, that have real proof and shown they can help. And there's a few things that are coming to the market that are really exciting. So I think there's lots of opportunities. If I leave you with a few kind of thoughts on how you pivot your practice or where you go from here, one, and maybe we can get into it with Sam a little bit later, that, there is a lot of custom compounding coming, and the idea is to really build this around. Some of it is the alternative routes, and you're going to see this from custom compounding and from the pharmaceutical companies with orals, once a month dosing, all sorts of different things. In our practice, we've developed this concierge medicine wellness expansion. So, we'll do prescriptions. They also see our surgery patients, and that way, so many patients now have insurance, but they have $10,000, $15,000 deductibles. And so the concierge medicine has been huge for us. I think there's going to be so many new medications. There is going to be a little bit of a revolving door of shortage. And then, the aesthetic, frontier is going to continue to evolve with so much skin laxity, volume loss, and these aesthetic naive patients. So you're going to see more muscle building, more of the peptides coming out that are going to be approved. So, if you're going to do something, I'd say diversify your program. Don't be just built around one medication. If you're going to go into the wellness, make sure you have a business plan. How are you going to build that whole thing out? I think there is this opportunity with the whole Ozempification, with these new patients coming to the market. They're not necessarily tied to a practice. So there's a huge opportunity. I think if you're looking at medications and if you're really trying to do the patients a service, you should really educate about all the medications out there, because there's different things and different points along the ways. And there's really happy to share some of the information, but there's actually some great obesity conferences and clinics that go on around the country that can really educate. And we're actually trying to bring some of these to the plastic surgery societies as well. And then lastly, it's a hard journey. At this point, if you're going to bring weight loss in, you have to really have a plan. Just having it on and thinking people are just going to come and fill your office, I think that ship has sailed in most cities. And so, really making sure, what's going to make your practice really, really unique, is just a race to the bottom. Typically doesn't work out. So appreciate you guys. And this is my little nugget that you probably heard in the background.
Thank you, Dr. Franco. It's always great to hear you talk so passionately about your program and what others can do. Erica, I'm going to turn it over to you to talk a little bit about the marketing.
Perfect. I'll get right into it. But first off, Sam, Dr. Franco, you two have been incredible. Dr. Franco and I might stay on here for like 5 more hours just to nerd out. We love GLP marketing. So with that, I'm going to get right into it. Okay. So, before I actually go into it, we're going to talk about some really basic things that you need to do in your practice to market GLPs. It's Dr. Franco just talked about this, but it's not like, hey, we have it and everybody's going to come and get it. You actually have to do a lot to market it because the space is getting more and more congested. You have telehealth, you have his and hers, you have a lot of practices offering it. So you have to do like a series of things to sort of set yourself apart and to market it successfully. And it's so worthwhile to market because not only do you get the income from the subscriptions, but these are all your future patients, right? Like Dr. Fraser talked about cross-selling, upselling, like these are your future, if you're a plastic surgeon, your future body lifts, breast lifts, face lift, it's your future lift, whatever has a lift in it, right? And if you're non-surgical, these are your fillers, your Botox, these are your patients. So it has a lot of value, not just in selling the GLP itself or your weight loss program, but in that cross-selling that's going to come around when you've really been having patients on these for some time. The practices I've seen who've had a program that's successful for at least a year, what they're making from the cross-sell and upsell is more than what they're making from the subscriptions. So just something to keep in mind, but there are a lot of things you have to do to put the work into it, but it will pay off. You just have to put the work in. So we're going to kind of go over what that entails and also some do's and don'ts, because obviously you have Sam to cover anything legal, but we've seen just a lot of do's and don'ts that are just simply from Google and social media platforms and like things you just can't say and can't do and things you can and what works and doesn't. I'm just going to get into that and break it all down. So first off, we're going to go over website content. You need to have good website content that covers this. I'm going to kind of lay out what I think that should be. One is that you should have a page that's just dedicated to medical weight loss. And you should be doing SEO on that page. Medical weight loss is one of the most popular keywords right now. And also as the drugs change, which might happen in the future, right? Like let's say one day you're not selling tirzepatide anymore. It's whenever in the future, you still have that medical weight loss page going strong for you and the SEO going strong for you. You should have separate pages that cover semaglutide, tirzepatide, anything that you have in the practice, but you should have one encompassing medical weight loss page that you're constantly working on. Obviously, you need to ensure all content stays compliant. The biggest thing is FDA approved, right? And I'm sure Sam could cover this in the Q&A more, but Zepbound is FDA approved. Ozempic is FDA approved. Compounded semaglutide, compounded tirzepatide technically is not. So you cannot put FDA approved in that content. And we've definitely seen that be an issue. Now, use blogs. So you can say things like Ozempic face and Ozempic body. And you could use a lot of blogs that talk about things within those blogs, or they could even be a procedure page. It could be like a page on your thing that just says like Ozempic butt, right? Within those, you're not actually selling your compounds. You're just talking about the procedure as a whole. So that way you're not really getting in trouble for going, let's talk Ozempic. Here's my compounded semaglutide. But you're just talking about what happens when you have a Ozempic face, and then you're selling them on your aesthetic procedures, and you're also kind of just driving that traffic into your website. And you could do a lot of blogs that go over these different things, or you could just write blogs about the process of taking medical weight loss, taking tirzepatide, taking semaglutide. You could just do a lot of different blogs that sort of cover the subject as a whole. If there's side effects, the best things to do, like what a B12 shot does, if it helps you with your medical weight loss. Like you can cover so much content, but if you are selling medical weight loss in your practice, I expect you to have a minimum of like 10 pages of content on your website, whether it's blogs or main procedure pages. It really just needs to be all encompassing, covering it from different angles. So let's talk about running ads. Ads are amazing. They perform so well on GLPs. If you run your ads correctly, they have a really pretty low CPA, like cost per acquisition, cost per lead, and they will get you a lot of new patients. There are a ton of do's and don'ts. Google and Meta, when I say Meta, it's a parent company for Facebook and Instagram. So those little Instagram sponsored posts that you see when you scroll, those are called Meta. Those are from Meta, right? So Google and Meta have a lot of rules, but I mean a lot of rules. And I'm going to walk you through them of what you can and cannot do on these platforms because they're actually different, right? There's some things you can do on Meta that you can't do on Google and vice versa. So running Meta ads. So you can't have side-by-side before and afters. It will get flagged, banned, or a form of like sort of shadow banning, which means you don't get as much impression share as you would like. So you can do before and after in like a video, or you could do it separated out. So they just can't be side-by-side. So you could have a patient talking about their journey, and you could show like a before picture, and then it goes back to them and they're talking more, and then it shows their after, right? Like that. and that's okay. But if they are side by side, your meta ad's not going to be able to go out. You cannot promise results on meta for a given time frame or even suggest them. You cannot say most patients lose 20 pounds in the first 6 weeks. You cannot say anything like that. Even if your ad temporarily gets approved, it will definitely be banned or not get as much impression share in the future. Messaging has to be positive. It has to be very body positive. You can't use like insinuate a perfect or ideal body type. Like, you know, that like kind of stock image with like a man or a girl and has like a little like measuring tape around their waist. It's like really common. Like Meta doesn't like that. Meta will shut down your ad for that image. You cannot use that image. Anything that's kind of like that. So you really want to keep your ads more focused on health benefits and feeling good and having more energy, and you know, your cholesterol is lower and things like that is what you want. It's not that you can't mention your weight loss. It's not that you can't mention that you lost weight, but it just has to be more health focused. On Meta specifically, you cannot say semaglutide or tirzepatide in the ads. It's not because of any FDA regulations or anything. They do not allow you to say any drug names on Meta ads. Just a rule for Meta. We'll get into Google in a little bit, but you cannot say that. So you have to use the word medical weight loss. And just so you know, like, patients understand what you're trying to say. So don't worry about it too much. It's just a rule with Meta. And then my favorite video is always going to be a patient testimonial video, meaning a patient, like I kind of have a clip of one here, but talking about their journey, saying what it was like for them. They walked in the practice. Everything was amazing. They had specialized care. You know, they went to a treatment room and they got given, you know, vitamins along with it. And like their journey with their practice is going to be the best Meta ad that you could possibly do, way more than you talking about it. Like using a patient talking about their experience over you talking about it is better, because you are competing with his and hers. You are competing with people who are priced much lower than you. So the best thing that you could do is put an ad out there that shows that personalized one-on-one attention, how great your practice is, shows a patient like actually like walking into your practice, sitting down with a doctor, like showing that sort of care and getting them to understand like, this isn't just some like, you know, virtual interview, telehealth, here's your subscription. This is like a one-on-one, you know, treatment and kind of showing your value, because you're seeing the person, you're taking care of them, you're adjusting their medication, right? You're adding medications. They don't get any of that with telehealth. So you really have to make sure it's really clear in your ads. Okay, now let's get into Google. Okay, Google ads. So you have to use landing pages. This is true of all Google ads, just for the record, but you should have standalone landing pages that link on a subdomain to your website, but they shouldn't just link to the content on your website. Google really wants you to use landing pages, so you create landing pages. Similar to Meta, you can't promise results in a time frame or insinuate ideal body type. What you can do is have patient testimonials written on there. So a patient can write in their testimonial, like, hey, I lost 20 pounds. And like they can say it in quotes in a testimonial, but you just can't say it in the rest of the copy on the ad itself. Now on Google, we have found that you can mention semaglutide or tirzepatide. It's 50-50. Sometimes Google allows it, sometimes they don't. But honestly, there's workarounds, but they're not strict about the way that Meta is. You can use side-by-side before and afters in Google ads, and I strongly suggest having like a few of them, and you could say like real patient results or potential weight losses or something like this. But similarly, you want to focus on health benefit more than weight loss. You include the weight loss, but you really want to have a lot of health benefits in there. Now, legit script certification. So let's just talk about this. Now, some of you may or may not know what this is, but it's a program that basically allows you to be an online pharmacy. So Google and Meta don't have a categorization for an aesthetic practice. They don't have a plastic surgery. They don't have a med spa. Technically speaking, we are under prescription drug providers. We are an online pharmacy to them. And that is unfortunate, but that is what it is. And what you could do is go through a certification process that it's a little bit lengthy, definitely takes a little work, but there's only one. It's called Legit Script Certification. And it basically means that they're a little more loose with you on the wording. You'll get less things banned. You'll be able to say a little bit more. You'll be able to promise more more results versus being a little bit vague. But the truth is that the process is pretty lengthy. It can help, but it can be challenging, particularly on Google. So in terms of whether you want to do this or not, I really only suggest doing it if you have a large ads budget. Like, I mean, you're planning to spend $15K and upwards on your medical weight loss ads a month. And like, you're very serious about that. So you want to be able to say whatever you want. You want to do a lot more creative. You want to have multiple landing pages, then it might be worth it to go through the certification. But if you're not like going that heavy on it, I personally don't think it's worth it. But once again, that's a personal decision. So organic social media, obviously you need to be posting a lot. You need to be sharing patient videos. You need to be talking about transformation stories. Your organic social needs to have a lot of content on why your practice. One of the reasons we love working with Clarity so much is they have these incredible videos, right? Not only do they have like the platform and the consultants and everything else, but they have a lot of amazing videos that educate patients, right? Educate them on a practice and going through different parts of the practice and making sure that they understand different things. And you need to be sharing videos like this on your organic social. You need to make it really real to a person of what it would be like to go to your practice and have medical weight loss. You need to have also shorter, like before and after photos, and have little short videos, little clips of people saying things, but you should be showcasing why your practice on your organic social, because especially if you're running meta ads and people are going to go look at your organic social as well, right? So just another thing to keep in mind. Email marketing. Email marketing and text message marketing are one of the two most underused aspects of digital marketing. Yet it is the cheapest form of marketing you will ever spend your money on, with one of the highest return on investments. It is so worth it to put the effort to put a couple standardized monthly, like weekly or monthly emails out and have at least one good text blast a month. It really is worth going through the effort, because it's not much. You put together some good copy, you put together a graphic, you send it out. You need to be sending out monthly emails, at least focus on your medical weight loss. You need to be promoting to your existing aesthetic patients as well. If you just added medical weight loss into your practice, you have a group of aesthetic patients as well, and you need to be cross-selling them. Additionally, sometimes leads take a while to convert, right? You're going to have that person who's like, okay, I want to get on semaglutide. I'm just picking my practice. Great. You're going to get them. You're going to get that lead in. You're going to close them. Fantastic. But you're also going to have people that go like, I'm still researching it out, and it's December, and I'm going to start it in January. Or maybe they just need a few more months in that. It is a big commitment and it's a big change, right? So you definitely have people who are still in that research, because as exciting and as how quickly GLPs have taken off, they're still relatively new to the public, right? So some of them are kind of waiting or biding more time, or they want to see it out and about a little bit longer, even though technically they've been around for a long time, right? As we know. And you want to make sure that you're following up with those leads. Like, you should have a strong CRM. You should be doing automated like text follow-up. You should be doing email marketing there. So there's like two kind of types of email marketing and text message marketing you could do. One is for your existing patient base, and one is really as part of your leads follow-up through a CRM. Like Lindsay talks to people about this all the time with Clarity. And I know, the rest of the consultant team does well, but like, you have to follow up your leads. And on medical weight loss, I feel like it's so important, because I feel like there's a bigger percent of people on the medical weight loss side who sometimes are earlier on the sales journey, meaning they're not quite ready to commit yet. Whereas then some of the Botox leads you get might be closer to being ready to commit by the time they've reached out to you. So you have to just keep nurturing it, and you have to keep reaching out. So I'm excited to get into Q&A, but like, honestly, that's just my summary. You have to build a strong foundation with compliant website content. You have to have like engaging social media that highlights patient results and why you. Stay consistent with email marketing, nurture your leads, and then run paid ads. They work really, really well. I know there's a lot of rules and do's and don'ts that I just covered, but if you get it right, some of those, like I said, they have low CPAs and they bring in a lot of great leads. So they're really worth running. All right, that's what I have.
Awesome. Thank you, Erica. And thank you for also a great lead in for me here to share with everyone about our patient education videos that you mentioned. Of course, Clarity has a full library of patient education videos for surgical and non-surgical aesthetic procedures, but we're very excited to share that we are launching a weight loss and wellness journey. I'm going to share a little clip here, an overview, and then we're going to talk a little bit specifically, and Erica touched on a few of these things, but how these videos can help you in your practice. All right, let's see if we can play it here.
So many of us are looking for ways to feel better, to take care of our bodies, and to stay healthy. Whether you're dealing with hormone changes, are somewhere on your weight loss journey, or are just looking to improve your overall health and well-being, there are options. Our goal is to support your wellness on an individual level. We want to go beyond the care you might get from your primary care physician. Your health is incredibly nuanced, And what might be considered normal in traditional medicine might not be optimal for you. That's where we come in. We'll take a closer look at these individual treatments and therapies in the coming episodes. See you there.
All right. So just a little clip about our new weight loss and wellness journeys. But how can these really help you and benefit you in your practice? Well, one, as you heard, it does take a comprehensive approach to care. And that is really how you should be looking at the care in your practice and talking to your patients. This gives you an opportunity to educate your patients on many different procedures. That education of your patients is really important, but also engaging with them, making sure that you're building a rapport. Erica mentioned this, and it's something that we preach a lot about, but we need to work on retention and expansion of our existing patient base. When we can do this, it does help increase revenue in our practice. These videos are a great tool to be able to use in your targeted marketing, in your social media, in your e-blasts that you're doing in your newsletters, and also just sending directly to the patients, either prior to consultation or post-consultation, to educate them on what was discussed. Our portal has data analytics to help you with this. And then it's very easy to use, and we have a seamless setup to help you and your team in your practice. So why would you use this? Well, benefits to the providers really includes revolutionizing how you are educating your patients. These short videos go right to the patient. And again, it really helps empower the patient to understand what's happening and ask the right questions. This leads to better consultations. Comprehensive and a holistic approach with these videos. They cover medications, they cover supplements, nutrition, exercise, and aesthetic treatments. And again, that integration into your practice. You can send directly from your Clarity Practice Performance system, or many EMR systems have the capability of integrating with us. Now, what's the benefit to the patients of integrating these types of videos? Well, again, it helps them feel empowered. Patients want to understand the treatments and the medications, and it helps them really understand the next steps in their care. So it takes a lot of their anxiety away about what's going to happen with a new treatment. Dr. Franco spoke about the wellness wave and also seeing a lot of younger patients getting into weight loss. And for them, aesthetics may be very new. So having this information available to educate them can really put them at ease about moving forward. That holistic support, it helps them realize that this isn't just about a medication. This is about a lifestyle change. It's about nutrition. It's about exercise. And that our goal should be sustainable results. Convenient access is one of the really great things about our engagement videos. These videos are on demand. They're sent directly to your patients on their phones via text message. We do have the capability, again, of sharing on social media, using QR codes so that you can use them in a variety of ways. And then personalized care. Again, this goes back to building that rapport with the patient, fostering that trust and confidence that you are building a unique journey for the patient. And they realize that because the journeys that you're sending them, these educational journeys, are specifically the treatments that you've talked to them about. So we're really excited to hear your Q&A for our panel this evening. And I'm going to put this up here. As I said earlier in the evening, if you have any questions following our presentation, you can certainly reach out to our team. You can scan this QR code and reach us. So at this point, I'm going to start with the Q&A. So remember, open that Q&A window. Drop in your questions. We do have a couple already in here. As I suspected, Sam, the first one is going to be for you. The question is, how is it possible for the FDA to dictate compounded drugs that are not FDA approved when the FDA approves the supply chain regulation and compounding pharmacies. So can you just share a little bit of insight about the difference between an FDA approved drug and then the oversight that they have over the compounding process?
Yeah, here's the deal. Compounded drugs are never going to be FDA approved, and that's because of the inherent just impermanence in what the formulas look like. And the reason that when we're talking about these FDA approved drugs being approved is because they are set formulas, they're not really changing, and compounding by its nature just leads to a lack of being FDA approved. That being said, one of the reasons that we're so concerned with shortages and when we can compound is this concept of it being essentially a copy of an existing drug. And the FDA uses that a lot in both the drug side and the device side, where they'll say, hey, is this similar to something we have on market? Is this similar to something that we've already approved? And they'll utilize that to kind of fast track approvals, or at least interim approvals. So I wouldn't get too caught up in the approved versus not approved. Anytime we're talking about drug safety or device safety, it is well within the purview of the FDA. And so we just got to kind of roll with it.
Great. This kind of goes along with the FDA question here. Another question is, in light of new administration's nominee who will oversee the FDA being in the compounded pharmacy space, do you foresee any change coming? I know Dr. Franco mentioned that he thought maybe some of this is going to get kicked down the road a little bit due to change in administration, but just from a legal perspective, do you anticipate there being a shift in this?
It's tough to say. I mean, honestly, anything that I would say would just be pure speculation. Ultimately, I think, the FDA has a long-standing set of rules regarding compounding and what can and can't be done. And so, no, I don't see any sort of real seismic shifts in this. That being said, Lindsay, I agree with you and I do with Johnny. The FDA they've shown their hand. Like they are fine with this being compounded as long as it's being done safely. And frankly, they're just kind of taking their sweet time, which I think is a smart play on their part. But as far as incoming personnel from the new administrations, it's throwing darts blindfolded. We really can't take anything from that.
For sure. Dr. Franco, this question is for you. What other weight loss medications do you use in your practice? Are you using metformin, Contrave, Vyvanse? What all do you have in your toolbox for your weight loss program?
Yeah, not to go too down the rabbit hole, but Contrave is a great one. Another one called Qsema, which is they're both kind of compounded mixed up, but through companies. The really cool thing is they've tried to make a splash to compete with the GLPs, even though they're haven't been shown to be quite as effective. But I mean, still a lot of people are losing 8 to 10%. They have a lot of patient assistance programs where patients can get a 3-month supply as cheap as $99. So, price is an issue for a lot of the patients that we're seeing that have BMIs in the 28, 29, 30 stuff that aren't, it's a great option. Sometimes it's helping people just dip their toe into it. Also, I mean, if we're being real, I mean, finances are tight for a lot of people, especially if you got kids and families and stuff right now. I mean, you got to see how far you can spread some of this. And it's been interesting as I've been able to spend some time with some of the obesity centers and conferences, things. It's been interesting how they've taken a stepwise approach on this. And if you think about it, right, we don't, for any of you guys that are surgeons or treat, really severe illnesses, we don't just give vancomycin to everybody, right? We start them with what they need. And so, I don't know that everybody, triple G will be super exciting because it's the newest, hottest thing, but not everybody needs to lose 25, 30% of their body weight, and we've taken the other side where there's a lot of people we've had to pull off of it. And I think Sam talked about it earlier, whether or not they're on this FDA list stuff, you still have to medically make right decisions, because that doesn't clear you from being held responsible from the medical board. And I know Sam deals with some of those. You still have to be a good provider, good physician, and those things don't go away. And we definitely set a lot of goals for patients and making sure that they're staying in a healthy spot and not just trying to get them as skinny as possible. We end up pulling a lot of people off or weaning them back and so forth. The other thing just to think about, and there's this question of whether people will build resistance, and where do you get them in terms of a maintenance, especially with some of the cardiac benefits and so forth. So I really, really think we're just scratching the surface of what's a good spot. So I do think utilizing some of those other medications is going to be helpful.
Mhm. Great, thank you. Erica, I'm going to kick this one to you, and you did touch on this a little bit, but there was a question about from a legal perspective, and I know you're not the lawyer on here, but how are you able to use the brand names Ozempic in your marketing? As Dr. Franco had mentioned, the Ozempic butt, the Ozempic face. So can you go back to that and just take another minute and cover why it's okay to use those terminologies for procedures in that way rather than using it for the medication?
Sure. And I'll let Sam correct me if I'm wrong, but we haven't seen an issue with this, which is that you're talking about two different things, right? When you're talking about your semaglutide, your TERS, your medical weight loss, you're trying to sell your medical weight loss program, right? When you're talking about Ozempic butt, Ozempic face, you're talking about conditions or loose skin or sagging that has occurred as a result of major weight loss. And then you're typically talking about your breast dogs, your lifts, your tummy tucks, your fillers, your Botox, your RF microneedling, your lasers, whatever you got to fix that thing. And it's a different subject. One is actually to kind of get your aesthetic patients, or just to get eyes to your site. It might just be a blog where you're not selling anything and you're literally just talking about the problem, which really is a trendy or cool way, or on topic social media wise way of saying you got loose skin because you lost weight, and there's different ways to fix it, or let's talk about it, right? And that's okay to say. It doesn't have to even sell or promote any of your services. You can just have content that talks about these things. Truly, you can have blogs that talk about anything, really, anything that you want, within reason, obviously, but that's our experience. It's not like you're talking about a Ozempic face because you're selling your compound semaglutide. Does that make sense?
Right. And Dr. Franco, I'm going to assume that you will do an Ozempic butt procedure on anybody, whether they did weight loss with you or not. Right. So, right. It's like a condition, right? After the weight loss, right? That's what we're seeing is.
And I think some of Erica's point is you should be talking about some of these weight loss secondary effects, whether you offer any type of weight loss wellness stuff. People are searching for them, and even listening to phone calls, educating your staff. It blows my mind, and I know everybody who owns their business, sometimes has heart attacks listening to phone calls, even though you have to do it. When you go over this, we made those treatment plans, and I thought they would be super helpful for our staff and our providers. And I think they were, and for the patients. It was amazing how much it helped our call center, our front desk, because it organized their thoughts, because, we've trained our team to tell people we don't offer, Ozempic, because we never want to say that we're offering this brand name medication in the office, right? We'll write a prescription, but they got to go get it somewhere else. And, we don't have it in the office. And so then somebody would call at the beginning and be like, "Oh, do you have a treat Ozempic face?" "No, we don't offer Ozempic," and it's like, and so if you don't train the office, it becomes, they're trying to do right, but they get lost in the rabbit hole. So really, really making sure you educate them, because you may be a great facelift patient and they're calling and your office staff is telling them, "No, we don't treat Ozempic face. We don't have Ozempic."
Yeah. I agree with that so much. You have to make sure that they're being smart. But also, just another blog with Dr. Franco, you talked about this earlier, but I would write a blog right now, Zep down beats Wegovy. You can write a blog about that. for the record. Like, you're not selling anything. You're just writing a blog about what happened in their clinical trials. Like, that's all stuff that I suggest.
And there's such easy ways to do blogs now. Like what I'll a lot of times do is I'll be on the treadmill in the morning, you know, before I go in, I'll dictate something into Google Docs. And so I'll dictate my whole blog thing. And then my team will just use ChatGPT and clean this up, fix all the word stuff things. And so
Yep.
it's basically done and set. And so you can actually make this, it's still what I want to say. It's still my term stuff. It just all the things of sitting there and doing it reorganizes that and is super, super helpful. So there's no reason not to do them in this day and age.
Yeah.
All right. We also, this one, Sam, is going to be for you. The question is, several compounding pharmacies came forward after the initial scare with tirzepatide back in October, when it was pulled from the shortage list. And they stated that because they compounded with other ingredients like L-carnitine, L-arginine, that they would be able to continue offering the medication despite it being pulled from the shortage list. The question is this true? Is this legal? And is this a potential solution in the future when final ruling does come down on tirzepatide, if it does come off the shortage list?
So it's a really common question. And very rarely do I just flat out say no to things. But really the answer is no. When we're talking about the ability to compound something because of a clinical difference, there's really strict rules on how that works. And just simply adding something to the chemical structure doesn't create that clinical difference that we're looking for. And the really important thing is when we're talking about compounding exceptions for clinical differences, they're individualized. So we are talking about, Lindsay, does this drug make a clinical difference for you? So for example, a really easy thing to do would be, with the older population, a lot of times they'll have trouble swallowing pills. And so we need to have this in a different route so that we can, have them take it as a liquid or take it as, subcutaneous injection. Something like that, absolutely 100% clinical difference. It's required, it's individualized, but this concept that they can, change one thing broadly and apply it to patients in mass, it really has no, it doesn't hold water. And I think the one thing that's always really, really important to remember in this is each of us has different risk. And I think a lot of times the pharmacy side will look at things and they will come to a conclusion and say, this is an acceptable risk and we're going to continue to do this. But the pharmacy risk is very different from you as individual providers. And you do have some level of responsibility to, frankly, have due diligence into the products you're getting. And if you're relying on a claim that, adding B12 or L-carnitine or whatever is creating this, kind of systemic clinical difference, I don't think there's not really scientific substantiation to validate that, and it puts you at risk as an individual provider.
Sam, I think it's such a good point because you probably got it from, I think you guys got some from us and stuff that we forwarded on to you stuff. But when this happened, so many of the compound pharmacies were sending out emails with like, oh, just put this in your note, just do this, just do that stuff. And it was, a bunch of different things. And so just being careful of what you're doing without running it by a group like Sam's or whoever, is helping guide you with some of that, because it can really lead you down a path.
Yeah, absolutely. We share that often, that we are definitely not attorneys, so we recommend that you get that guidance when you have those kind of questions. So All right. Well, we just ran through all of the questions that are in here. I'm going to open it up and see if there's any additional questions or anything additional from our panelists that you guys would like to add before we wrap up this evening.
Lindsay, one of the things that I think is super interesting, and Erica talked about it, is sometimes how long it takes for, especially if you're running ads, to convert some of these people. And Erica talked about, like, we create a bunch of content, and we have several full-time marketing social media people in our office, and we still use Clarity. And so, I mean, I think there's different areas to use this. And so, some of the stuff like BBLs or something that's super passionate, that's my baby, I'm gonna make my own video. But the idea that I'm gonna make like video content, and I think video is king, for every little procedure, like, we may want to do it, but realistically, I mean, there's only so many hours in a day, and I think there's lots of ways to supplement this. But if you're spending a ton of money on ads, or to your own patients, and you're not speaking to them, like, because some of these videos, some of these links, you can actually tie into your newsletters, you can tie them back to your office, you can track some of these. So I think there's some really low-hanging fruit of converting those leads, which is going to up your ROI. Like, even when we look at our social media ad stuff, it's interesting. If the longer you track them, the higher that goes, right? Because, to Erica's point, there's the few that are going to convert right away. What's also interesting is how many of those people, when we actually look at our system, were past patients 2 or 3 years ago and either saw an ad or something and re-engaged with the practice. And I think that's some of the things that the videos that you've created do. And like, just for people, whether they use Clarity or not, when we do our stuff and they start our weight loss program, they automatically get put into our drip campaign, right? And so, the first couple months are all about, the weight loss journey and some health habits and stuff. Once they hit the 3-month mark, then it switches over to some of the weight loss side effects, like, here's the, and we have a whole series of like face, butt, so forth, along there, so that it helps them along that time. So I think there's a lot of ways to integrate this at different parts, depending on what you want to do.
Absolutely. And I think, you touched on as well the training for your staff, right? And so
Yeah.
one of the things we do a lot with is training the staff, training them on how do you talk? How do you answer that phone? How do you answer those questions? How do you make sure your team understands the services that you offer and how it relates to other name brand things, right? Like, we don't want to be saying, oh, no, sorry, we don't offer that, when really we have something that's exactly the same. It's just a different device or, a different product. And so, we definitely focus in a lot on those things because it is very important. That conversion, it takes time. We've got to nurture those patients. And certainly that retention piece. And I love that you mentioned the drip campaigns. I talk about that a lot. I know Erica works with clients a lot on getting those types of things set up. That's super important, really, to continue that nurturing relationship ongoing and transition them over to other things, right? We think about, very simply, Botox patients, 70% of them end up also getting dermal fillers. Well, we want to nurture them into educating them on that, making them feel comfortable making those choices. And I really think that these wellness and weight loss programs aren't different. So many of these things all go together. And once people start, seeing their health and their body change, they get more into the aesthetic treatments too, right? Which is where our practices need to think about how we really nurture that and then educate them. So, Eric, I know you unmuted, and I know you love this stuff so much.
I would say all of the above, everything we said, but specifically, you mentioned the staff training, Lindsay, and I know you've done it with so many practice, and Clarity is so good at the staff training. But there is, and I unfortunately we just don't have the time to get into this right now, but there is a whole technology and way that you train your staff to handle leads from paid ads specifically versus organic. Like, that could be another webinar. You guys want it? We can make that happen. But there is a way that you actually handle ads. So when you're spending money on ads, you're actually getting a high conversion rate and a high ROI from those paid ads. And your training of your staff and how you do that, it's really, really particular. And Clarity does a lot of great staff training, but it's not the same process actually as your organic or referral leads. It actually has a different process. So That could be a whole nother talk, but that goes into follow up, you know, drip campaign, the speed of response required, like all of that is so important.
Absolutely.
And I know you focused, Lindsay, just on weight loss because that's what tonight's talk. But you guys have a full spectrum of different topics, which is cool because you know I know Erica could talk about hours of this in a different thing. But one of the things that we've even been focusing is we've always done like our monthly newsletter, but it was such a broad topic, and then it's getting too long. Now we've really tried to segment it out. So like, you know, whatever we've tagged those people out to be super specific, then we're sending them very specific content that's more, you know, tailored to them. So there's some cross-selling, but also focused around their general issue stuff. And with CRMs, it's so easy to do that. And then like with Clarity, again, you don't have to create 5,000 different topics, right? You know, or maybe you've created 3,000, you're just missing the other 2,000 and you want to supplement it till you make those. I mean, there's all sorts of different ways, because I feel like by the time you get them made, our stuff's been outdated, and then we'll have to update it. And I know you feel the pain because you guys are always updating your stuff too, but it's hard.
Yeah, for sure. And one of the things with the Clarity platform is there is the data analytics as well. So you can see how much of that video they watched. So when you're doing those targeted marketing efforts, right, you can then use that to retarget. And again, we'll have to bring Erica back to specifically do an entire webinar where she gets to talk all about this specifically. But absolutely.
But Franco, you should come with me too. I mean, it's not like you don't have a successful practice or anything. You can have different side.
Absolutely.
I'll bring Sam in too. There's always
Sam can just
no
join
what
us
we
anyway.
do.
Yeah.
Just hang out in the background.
Well, I do want to share that Marcus from our team here at Clarity did drop in the chat full links where you can watch the full videos that we were previewing with you this evening. So please take an opportunity before we close out this evening to click on those links so that you get a chance to watch it. Dr. Franco, I know before we wrap up, I would love for you to touch on one thing prior to this starting, when we were all just chatting and getting really excited. You did mention some things. Maybe we'll do a New Year webinar about some peptide things. Will you share a little bit about what was going on today that you're very excited about?
Yeah, so there, because it ties into the wellness and kind of what we've talked about, the cross-selling and doing when people get excited about the wellness stuff. And so there was a bunch of peptides on the market. And it's been a little bit of like the GLP stuff where there was a bunch of peptides where FDA pulled a bunch and put them on the ban list. And then now there's several that we're evaluating to bring back, and most of them were around peptide and were around muscle building and wellness. And you'll see some of our industry partners are going to make a big push, with direct to consumer marketing of muscle, and you probably can guess which ones have this on the docket for them. And so, I think really cool to be able to tie in some of your e-stem devices with some of these muscle building peptides, especially with so many of the patients now being educated about muscle loss with these GLPs. And so we have patients asking, what can I do about this? And so, better for them to get something educated, something that is, approved, that's not, that's a legitimate medication stuff. And we can always get into the compound like kind of certifications and stuff that you should be asking for as well. But I think that's super exciting that those things are there's at least going to be a few more on the market very, very soon.
Absolutely. All right. Well, thank you everyone for joining. We were really pleased to see all of you turn out this evening for our presentation. We want a special thank you to our all-star panel this evening, Sam from Byrd Adatto, Dr. Franco, and Erica Crawford from Influx Marketing. You guys, thank you for your expertise and sharing all of your insights and tips with everyone this evening. Thanks for joining us, and please reach out if you have any questions. Have a great night.
We'll see you guys. Bye.
Good, y'all.